Hi, everyone. It's Caleb here, one of the pizza edges. I'm just going to do a quick video on neonatal ward round. So the ward round here in Antrim in NICU happens 9:30 in the morning. So normally Reggie's get in at 9 and well, alongside the neonatal nurse practitioners, kind of take a couple of patients and prep a ward round note, and then you'll do a consultant-led ward round about 9:30 or so. So we've got a test patient here. Just ignore the fact that they're 2 years old and pretend this is a baby in the neonatal unit with a neonatal navigator tab here, and we're going to do or start a ward round note just to show you. So there'll all be consultant ward rounds mostly during the week. And then if we go to our smart phrases here, so Neo daily word round, ICU one, pre-fill here. So baby, if they're actually in neonatal, this will pre-populate. It'll also pre-populate with their named consultant, and you click from the drop-down list which consultant it is, and their problems will be brought across. And if they're preterm or under 1.5 kilos or under 32 weeks, then you can talk about cranial ultrasound, ROP. Make sure the right reflexes have been checked in the first 72 hours, and if vaccines are appropriate. A lot of the time it's maybe not, so you can delete as needed. A brief summary of issues overnight: tolerated high flow, or need to go into CPAP or wean down their flow or something like that. The obs will come across here, and our ventilation type. It's not working very well because this is a 2-year-old, but it'll come with a little tab here, and you can click invasive or non-invasive respiratory support, usually non-invasive, and then you click high flow or CPAP if needed, or if they're self-ventilating in there, just delete it all. I normally delete those wee bits there unless they're specifically relevant, if there's high lactates or I'm monitoring the gases for whatever reason. If they're day 1, 2, 3, 4, etc. of life, or if they're hypo risk, they might have started in higher fluids, so you can click which volume of fluids they're on and what sort of fluids it is. If they're a preterm baby, they may well be on parenteral nutrition. It might just be IV fluids if they're a term baby in the first 24 hours of life, or they might be on a mixture of tube feeds, bottle feeds, fluids. It might be a mixture of all of them. You fill all those in, and then the milk type. So because they're on our enteral feeds, so maybe say they're, I don't know, maternal ABM and Nutriprem mix or something like that. You just fill that as you go. And then any recent results. And then this part is designed for the registrars to fill in their plan in the morning, and then sign the note when you're finished. And then we can come back to the note during the neonatal ward round and add any additional stuff in here. I've probably said this in a previous video, but if you're filling all this in, please sign it. Don't pen it, because if you pen it, it's only you who can then edit it again and write the ward round plan. Whereas if you sign it, any of the doctors or nurse practitioners on the ward round, if you've got called to a delivery or something, will then be able to edit and write and type in the ward round plan. During a Wednesday ward round, we now do a developmental ward round on a Wednesday, so there's a different performer for that. If I delete this performer and just show you that one. What's this one here? So every Wednesday you get a developmental ward round. A lot of similar stuff in it. The difference is when you move on down here, it talks about developmental assessment. A lot of this is asking our nursing staff in NICU if they've displayed cards suitably, and if they've talked to the parents about certain booklets, and it's just all about developmental care. Some of the stuff will not be particularly relevant if your baby is only 24, 48 hours old in the ICU. This is much more relevant, particularly for our preterm babies who have transitioned across to special care. Trying to put a decibel noise on it as well, or decibel result. There are apps for it. The nurse practitioners have the apps, and they often will do that. Now, this has only been introduced fairly recently. If they're in NICU, the incubators tell you a decibel reading, and that's what I've been going off. If they're in special care and they've moved out of an incubator, then usually you use an app to try and check the noise level as well. It's all just about adequate developmental care for these babies. And then you fill in your ordering note as per the other protocols here. So that's our two templates we use for ICU. Special care has, again, a very, very similar template. I just delete this and very quickly show you. So and Neo developmental ward-round, and Neo daily ward-round, and there's and Neo special care ward-round, which will be there, but I've relabeled it myself because I've relabeled a few of these things for my own. And for example, I've got a NICU one here, and I've just got a special care one here. So it's the same pro format. It'll just be listed as Neo, Skiboo, ward-round, or whatever on your when you steal the smart phrases. Okay, not quite sure why it's come up with such big writing, but it's exactly the same. There's slightly less in it. You work through it. And this is our consultant that I was talking about. You can click whichever consultant's on, usually one of these usually, or the named consultant, and then fill through with your plan. And I see I've just kind of modified it a little bit myself, just so I've got my name and stuff on it, which you can do when you get here. And that's our neonatal ward rounds.